So he will be talking on study of the refractive changes and ocular biometrics in preterm and term infants. Welcome you, Ravi Kumar.
Good afternoon, respected chairperson and moderator, and my dear AIOS members. First of all, I thank AIOS for giving me the opportunity to present it again and for the award. My topic of presentation is study of the refractive changes and ocular biometric in preterm and term infants. I'm Dr. Ravi Kumar, and my co-author is Dr. Suchita Parisa. She is HOD at AIMS Bhubaneswar. I have no financial interest. Newborns with gestational age of less than 37 weeks are prone to various ocular problems. 15 million neonates are born premature worldwide annually. Full-term healthy newborn is generally born with axial hyperopia, and preterm newborn are noted to have myopia, hyperopia, or astigmatism at birth, depending upon gestational age and stage of ROP. Previous studies focused on ocular biometry after ocular stability age of 3 to 16 years, and information regarding refractive status in infants in whom dynamic ocular changes are ongoing is still limited. So the aims and objective of the study, the primary objective is to compare the refractive changes and ocular biometric between preterm and term infant in the Indian scenario, and the secondary objective were to compare the refractive outcome in preterm infants with ROP and without ROP, and to study the association of refractive errors with birth weight gestational age. So it is an cohort study incorporating 19 infants, 45 is corrected preterm and 45 term. Inclusion criteria were preterm and term babies born at AIMS Bhubaneswar between January 2019 till December 2019. And exclusion criteria were babies with systemic comorbidities like severe sepsis, hypoxic ischemic encephalopathy, or on mechanical ventilation, and ocular comorbidities with congenital cataract and corneal opacity, and other syndromic babies were also excluded. In Group A, the preterm baby were enrolled with 37 weeks of corrected gestational age, and their growth parameters and ocular parameters were recorded. And in Group B, enrollment of term infants were done. Also, the growth parameter and the ocular parameters were recorded in that Group 2. And they were followed up at the age of 3 months, and growth parameter and refractive error and ocular biometrics were recorded, and at second follow-up was done at the age of 6 months, and third follow-up was done at the age of 12 months. So coming to the results, this is the baseline demographic distribution of the infants, showing the gender division on the basis of gender, mode of delivery, number of twins and triplets, and socioeconomic status, and they were not different significantly. Coming to the primary outcome, the refractive status of preterm and term infants at birth, the first table is showing at birth, and the second table is showing at the 12 months. At birth, we can see that most of the preterm babies were myopic, which was similar to the same at birth. At 12 months also they were myopic, and the term baby were hyperopic mostly. And when they were compared at 12 months for emmetropization, only 7 infants, preterm infants, were emmetropized, and in term 13 were emmetropized, and it was not significantly different in both the group. Coming to the secondary outcome, among 45 total preterm infants, 5 infants had ROP. The worst staging was zone 2, stage 2, and mean spherical equivalent by age 12 months among 5 ROP infants was minus 0.25 with standard deviation of 1.81 diopter, and among the no ROP was minus 0.66 with standard deviation of 1.83 diopter. Independent t-test was conducted and showed no significant difference for ROP and no ROP with value of 0.64. So this is the correlation of mean spherical equivalent to the gestational age and the birth weight, and we can see that the birth weight is associated strongly than the gestational age. This is the graph showing the comparison of the mean spherical equivalent at follow-ups. We can see over here that the preterm baby, where the lower line is showing the refractive status at different follow-up or in the preterm baby, and the upper one is of term baby. The term baby are continuously tending towards the emmetropization, whereas in preterm baby, there is a dip till 3 months towards myopic shift, and then they are tending towards the emmetropization. So coming to the discussion, Larsen et al. And Saunders et al. Stated that among preterm with mild ROP or without ROP, there is myopic shift initially and delayed emmetropization. Pennefather P. et al. Stated that there is no significant difference between no ROP and stage 1 and 2 ROP. And Varghese R. et al. Also found that birth weight is more correlated to final mean spherical equivalent than the gestational age. So coming to the conclusion, preterm infants have tendency to develop myopia, whereas term infants hyperopia. There is no significant difference in immunopropagation among preterm and term infants at the age of 12 months. Among gestational age and birth weight is more associated with the final refractive status at 12 months. These are my references. Thank you.
Thank you, Doctor.